Hi, my name is Amber Washington, and I'm a student here at the College of Nursing, and today I'm going to be doing a safe medication administration checkoff. Here's my ID. I'm going to be doing a room scan. Alright, so the first thing I'm going to be talking about today is the no interruption zone. So with that, I'm going to be following the no interruption zone policy, making sure that the medication room door is shut, and I am going to be limiting my conversation with my colleagues, and I'm not going to be taking any phone calls at the time. Next, I'm going to compare my patient charts to that of the MAR. I'm going to be making sure that I have the right patient, the right medication, the right dose, the right route, the right time, indication, and documentation. So here I have Jaguar Jones, and we have Jaguar Jones, date of birth 8/25/1963, date of birth 8/25/1963, medical record number 4176352, 4176352, and his allergies are penicillin. His allergies are penicillin. Okay. After that, I'm going to be performing hand hygiene. And then we're going to choose our right medication, which is heparin. So we would go back and we would make sure that we have the right medication. So we have heparin, and we have heparin. We have the right dose being 5,000 units, the right dose being 5,000 units, and the right route being subcutaneously, and the right time being every 12 hours, and we have it every 12 hours. So now we will perform hand hygiene, and then we will choose the right medication. We have heparin here. So on my vial, it says that we have heparin 10,000 units per milliliter. The expiration date is 12/5/2025. And so I'm gonna show you guys that I have the right medication. And I'm gonna go back and I'm going to compare this to the MAR. So on my MAR, it says we have heparin 5,000 units. However, on my vial, it says we have heparin 10,000 units. So I'm going to be doing some calculation. So with my calculations, we have 0.5 milliliters to draw up in the syringe, and I'm going to make sure with another nurse that my dosage, that my calculations are correct. And then I'm going to make sure that I have the right time. So the right time is every 12 hours. So on my watch, I'm going to make sure that it's the right time. And afterwards, I am going to check the right route is subcutaneously. And so with that, we will be using our 1 millimeter TB syringe. So I'm going to choose my 1 millimeter TB syringe. So right here, I have it says 1 millimeter tuberculin safety syringe right here. Okay. And so before opening this, I am going to clean my vial off with an alcohol prep pad in a circular motion. Then I'll throw this away. Okay. And then I will open up my syringe. And I will take the cap off. And I'll draw back 0.5 milliliters of air. And I'm going to show you guys that I have 0.5 milliliters of air. Okay. All right, so we will be injecting the air into the vial. And then I'm going to flip it. And I'm going to draw back 0.5 milliliters. Okay. And then I'm going to recap it. Make sure I do it with one hand. I'm going to come around and show you guys that I have 0.5 milliliters drawn up. Okay. And And so then I'll go back and make sure I check with the nurse that my dosage and my calculations were correct. And then I'm going to correctly label this. I'm going to make sure that my label has the patient's name, the drug, and the right dose. So we have the patient's name being Jaguar Jones. And we have the right medication being heparin. And the right dose being 0.5 milliliters. And then I'm going to label my syringe. All right, so I'm going to take this and my vial and I'm going to compare it to the MAR. And I'm going to make sure that I have the right medication, the right dose, and I'm also going to reassure that it's the right time again. So we have heparin 10,000 units on the MAR. We have heparin 5,000 units. So we did our calculation and we ended up with 0.5 milliliters. And we have heparin. We have heparin and Jaguar Jones. We have Jaguar Jones, and we already said the right dose. All right, so I'm gonna go ahead and put this in the package to maintain sterility. And I'm gonna gather my materials. I'm gonna gather both my medications, the vial and the syringe, and my MAR, and I'm gonna take it to the patient's room. And so before entering, I'm gonna make sure I do hand hygiene. I'm gonna knock on the door. I'm going to introduce myself before hand hygiene again. I'm going to introduce myself. And so my name is Amber Washington. I'm a student here at the College of Nursing, and I'm a student nurse here at the College of Nursing. And today I'm going to be administering your medication. So I'm going to go ahead and identify my patient with 2 identifiers on his wristband. So I have Jaguar Jones on here, and on my MAR I have Jaguar Jones. Date of birth, 8/25/1963. Date of birth, 8/25/1963. Medical record number, 4176352. And we have medical record number, 4176352. And the patient is allergic to penicillin, and the patient is also allergic to penicillin here as well. And so I'm going to go ahead and ask the patient, are there any other allergies you have, sir? There isn't. So now I'm gonna go ahead and do a pre-assessment. I'm gonna be checking some vital signs. I'm gonna be looking at the blood pressure, any pain, the respiratory rate, and then I'm going to go ahead and do my third check. I am going to take my medications, and I'm gonna compare it with the MAR. I'm going to make sure that I have the right patient. So Jaguar Jones, we have Jaguar Jones, we have heparin, and we have 0.5 milliliters, and our dosage was 5,000 compared to 10,000, so we ended up getting 0.5 milliliters. And on my vial, it's the heparin, and we have heparin, it's 10,000, 5,000, and we still did our dosage calculation. All right, so we have the right medication, and so now I am going to raise the bed to a comfortable working height for me, and I'm going to lower the side rails and perform hand hygiene, and now I'm going to go ahead and put on my gloves and my goggles. Goggles. Okay, so once I have put on my gloves and goggles, I'm going to go ahead and expose the injection site only. And I'm going to, so with the injection site, it is going to be 2 inches away from the umbilicus, and it is going to be I'm not going to go past the costal margin. I'm not going to go below the pubis. I'm not going to go on the outside of the anterior and superior the interior and superior iliac spine. And so I'm gonna test for, I'm going to make sure that I assess for, good skin integrity, and I'm checking the muscle for good muscle and make sure that there's no bruising or anything. And so I'm gonna go ahead and clean off the injection site. I'm gonna move in a circular motion outwards. So moving in a circular motion outwards. I'm gonna go ahead and throw that away. Okay. And then I'm going, as I'm squeezing the injection site, I'm gonna make sure that I do not let go until I'm finished administering my medication. So I'm gonna go ahead and take off the cap. And with this injection, with subcutaneous, we are going to inject at a 90-degree angle, and we're gonna inject slowly. So I'm gonna go ahead and squeeze it, and I'm going to inject, and we are going to inject the medication slowly. Okay, and we would normally apply gentle pressure to the site, making sure not to irritate the injection site. And then we will we will put the safety up. We will put the safety up, and then I will throw it in my sharps container. And so I'm going to assess the patient for any allergic reactions. And so I'm gonna go ahead and take off my gloves correctly. And downwards towards the trash can, I'm gonna throw it away. And after that, we are going to, so we looked at the patient to make sure that there were no allergic reactions. And then I'm gonna go ahead and lift the side rails and make sure that the patient is in a comfortable position. And we're gonna lower the bed, and then we are going to gather the materials and go document at the MAR and to the nurse's station, and we are going to be documenting how the patient took the injection, whether there was any pain or anything. And then after 30 minutes or so, I'm going to return back to the patient's room to reassess and see if there were any adverse drug reactions, any adverse reactions to the from the injection. Looking for any reactions, and that concludes it.